Hey, and welcome to Medibles, where I talk about medicine, mindset, wellness, and so much more. I hope you stick around with me and learn something new today. Now let's take it to the whiteboard, where I will discuss everything you need to know about ulcerative colitis, including its causes, symptoms, complications, diagnosis, management, and treatment. Ulcerative colitis is classified as one of the inflammatory bowel diseases, also known as IBD. If you recall, a few weeks back I made a video on Crohn's disease, which is the other condition that makes up inflammatory bowel disease. Compared to Crohn's disease, which can affect any area of the digestive tract, ulcerative colitis always involves the rectum and progresses proximally up the large intestine as the disease progresses. In addition, the inflammation present in ulcerative colitis is continuous compared to Crohn's disease, where skip lesions are seen depending on the areas affected in the condition. Compared to the transmural inflammation seen in Crohn's disease, ulcerative colitis only affects the submucosal and mucosal layers. The presence of ulcers is also seen, hinted by its name. Although the exact cause of ulcerative colitis is unknown, a few mechanisms are thought to be involved. Ulcerative colitis seems to be caused by a combination of genetics, environmental factors, and defects in immunity, particularly in the gut microbiome. Genes seem to play an important role in the development of ulcerative colitis, and the chance of developing UC if a first-degree relative, such as a parent or sibling, has the condition ranges between 1.6 and 30%. An imbalance in the gut microbiome is another theory that is thought to be involved in the development of UC. Typically during enteric infections, there is an immune response, and the gut returns to its original homeostasis after the infection has cleared. However, in UC, there is an abnormal response of immune factors such as TNF-alpha, interleukin-13, and helper T cells. An imbalance occurs between the body's normal response and the enteric bacteria and can disrupt the gut epithelium. An interesting fact about UC is that there has been some evidence that shows that smoking seems to actually be a protective factor against the development of the condition, which is not seen with Crohn's disease. This may have to do with the suppression of the immune system that is seen in active smokers. It is estimated that approximately 3 million Americans have IBD, which is about 1.3% of the population, of which approximately 750,000 people are said to have ulcerative colitis. The typical age of onset of ulcerative colitis is between 15 and 35 years old, with most being diagnosed before the age of 30. The female and male populations seem to be equally affected. However, ulcerative colitis is seen more commonly in certain demographics, such as those of Ashkenazi Jewish descent. The symptoms of ulcerative colitis typically start gradually over a period of time and may take years for patients to get a proper diagnosis, especially if the symptoms are mild initially. Some of the most common symptoms seen in patients with ulcerative colitis include bloody diarrhea, which can also have the presence of mucus, lower abdominal pain, particularly in the left lower quadrant because of the involvement of the rectum and left side of the colon as symptoms progress, and fecal urgency, or the sensation of needing to use the bathroom immediately. In more severe cases of ulcerative colitis, weight loss, rectal bleeding, fatigue, and fever can also be present in patients. Similar to what is seen in patients with Crohn's disease, there may be periods of time when patients are symptom-free before having a flare-up once again. Hey, your friendly neighborhood doc, just checking in. If you feel you may be experiencing any of the symptoms described in today's video, please speak with your doctor or a licensed health professional. The diagnosis of ulcerative colitis involves three main components: blood work, colonoscopy, and imaging studies. Blood work is done to check for nutritional deficiencies, inflammatory and serologic markers, as well as to obtain a complete blood cell (CBC) count. A colonoscopy is the diagnostic method of choice in ulcerative colitis, where a scope is inserted through the rectum, where biopsies are taken, and the extent of inflammation is visible. Patients with ulcerative colitis are at increased risk for the development of colon cancer, so colonoscopies will need to be done earlier and more frequently compared to a normal patient demographic. Imaging studies such as X-rays and CT scans are done to look for any disease complications, such as bowel obstruction, perforation, or toxic megacolon. The management of ulcerative colitis is somewhat similar to that of Crohn's disease. Mesalazine and aminosalicylates are first-line agents in the treatment of mild to moderate ulcerative colitis and can be inserted as a rectal suppository in patients with UC limited to the distal colon. Corticosteroids are used when treatment with initial therapy is unsuccessful. In refractory cases, immunosuppressive and biological agents can be added. A colectomy, which is a surgical procedure that involves the removal of part of the colon, is typically curative in patients with ulcerative colitis because unlike in Crohn's disease, the inflammation in UC is limited to the colon. That's all from me today, but if you're enjoying this type of educational content, be sure to like, comment, and subscribe to stay tuned for much more to come. If you have suggestions on what you would like to see next, drop them down below in the comments, and I'll try to make a video on it. Here is another video I thought you might like and my latest upload in case you missed it. Until next time, bye.